Everyone see this? If you can't, just unmute yourself.
Yes, it's good.
You can? Okay. So Linda, if you stay on, just let me know if it freezes. I know oftentimes I have to stop sharing and resharing, and I'll just share it again. Okay. All right. All right. So today I'm gonna share my screen. I'll review the broker portal and just a series of forms. Any questions along the way, Linda will be helping us out answering via the chat, or just unmute yourself and ask us, and we can do it that way. It seems like a smaller group right now, so just unmute yourselves and ask questions as I go through the PowerPoint. We're also gonna record. Linda, let me know. Did you want me to record, or you'll record? So that
yeah, I started.
Okay, great. So this will be recorded also. So we'll send this out later so you can refer back to it, or if anyone misses the training. So if anyone wants to kind of just turn off their cameras if they don't want to come out, record it, or change their names that pop out on the screen, just FYI. So today we're gonna, just remind you, touch a little bit on the broker reauthorizations. I wanna go through some areas of the portal, just so you understand our way of business and what we're looking for, the very important elements of utilizing your broker portals. Just trying to gather a series of frequently asked questions, so hopefully I'll answer those along the way for everyone and clarify those. We're going to talk about startup or transfers and what that process looks like and what we look for. We'll touch a little bit about the monthly brokerage billing and FI sustainability. Then lastly, I'll share our updated website, the Cfssds FI page, which is often updated, and we'll open it up to questions on the end. And, hopefully Faye will jump on the call, and we can, for those that don't know her, introduce you to her.
I'm on, Jennifer, I'm on.
Oh, hey Faye, thanks. Okay, so broker reauthorizations. So at this point, it's already the 12th. Just a reminder, each year, brokers are required to, complete 12 hours of training per year. The year runs from August the 1st to July 31st. So by July 31st, 2020, you should have submitted 12 hours of training to the SD broker email and get yourselves reauthorized. I know there's, for those brokers that came on after July, I know that there's some differences or variances in that, and you can find all that information here. And I did upload our CFS broker policy, which I'm going to share shortly, and we captured that information there for you too. So at some point today after this meeting, I'll send a recap email, probably with this PowerPoint, our updated broker policy for you all to review and sign. You can email that back to me. And again, within there, you'll see any information you need regarding reauthorization. As a reminder, if you're not reauthorized, you're risking a lapse in services and coverages to your families as support brokers. I know some of you have individually seen us reaching out to you, so just make sure you get those in. I know that the list comes out each week and it doesn't necessarily update as quickly. So, we're sorry if we're reaching out, and it's because you're still not on the list, but I know some of you have forwarded the emails confirming that you did submit that information. I think there was one question so far. Okay, let me go ahead and share that policy briefly with you. So, and this is typically when new brokers sign on as contractors, vendors with us. This is part of the packet that you guys complete. I recently updated it. The big change really was just to capture this reauthorization here. So I won't keep everyone and go through the entire thing, but I'll kind of recap it. So, just a reminder of, we capture here what support brokerage services look like, what kind of support and assistance and training is needed to be a support broker, what the support broker services break down into. And again, this information comes from the OPWDD issued support broker agreement. So it's, it's a replicated information that I'm sure, you guys review each time you sign off on these agreements with the individuals and families you support. We'll talk on, I'll elaborate later more on staff action plans and the content that's required there and how often those have to be updated. So we'll get into all of that in depth. Same thing for planning, team, circle of support meetings. Those occur twice a year. And, oftentimes I understand that care managers may forget to involve the FI, but, as a support broker, ensure that, you keep us involved or keep track of those meetings and involve us on those reviews. And again, this is just a little bit of a breakdown on how to get yourselves reauthorized each year through OPWDDS brokers. Okay. Support broker service documentation. I'm going to go into the portal and I'll review that with everyone as well. As far as your brokerage billing, which is due the 10th of each month of the following month. So we'll review that. And then again, just on your own time, just, I know it's a 4 or 5 page document, just review it. Any questions, ask me before you sign it, but just ensure you send me a signed copy of this updated policy for broker, okay? All righty, so we were up to the broker portal. So I'm gonna go ahead into our mock portal that we use, which is Test Girl Casey. And I'm going to just briefly review tab per tab, okay? And I'll emphasize on the areas that I know that I get the most questions. So this is our mock portal for our Test Girl Casey. We're pretending here I'm her support broker. So typically when you're on your broker portals, this is what your screen looks like, okay? And you have a list of all of the approved budgets. And we're going by the top one, okay? Which for Test Girl Casey is a July budget. Anyway, so as you'll see, and especially for a new broker, or if you're new to the portal, the first thing you need to create is a meeting. And the content in Ivero translates over the same way that the policies and procedures do for support brokerage. There should be at least 2 meeting minutes a year. So we're saying that, as a support broker, you're working with an individual. In this case, let's say Test Girl Stacy's annual budget is July of each year. So what that means for me is that as a support broker, I need to capture 2 meeting minutes within the July to July year. And typically those 2 meeting minutes oftentimes coincide with the life plan review, okay? So that's the first part. So always make sure you capture your meeting minutes, at least 2 a year, in your meeting tabs. Now, what happens is if you don't have a meeting, and I should say an approved meeting, anytime you look at Ivero statuses, anything that is not in green means that it is in draft mode. So in this case here, if I'm, I've generated a meeting minute for Test Girl Casey, this was as an outcome of her meeting, and then we approved it, my status should be green, which means approved. Okay, so once you have an approved meeting minute in here, it'll let you generate the broker agreement. Now, I know outside of Ivero, we ask for the actual OPWDD issued broker agreement form. And it's not really, necessarily us as the FI. It's just something that even though you have to create it on Ivero, we still have to have it on file because, as you know, oftentimes when you submit a new budget, an initial budget, a request for startup, or even a transfer to our FI, it is just something that has to form part of the packet to the DDRO, and that process is outside of Ivero. So, so once you have an approved meeting minute and you create an agreement, anytime you want to create something new on Ivero, you're clicking this plus sign, Okay, so in this case, we already have a startup broker agreement in there. Make sure you select your fees, make sure that it's paid to you. So all of these things, we kind of link it in the background on the FI end. We make sure that we list you as a vendor. We make sure that we plug in certain information so that you're able to do these things and save them. So again, anytime you want to create a new agreement, you're clicking that plus sign. Or just anything new on the portal, there should always be a plus sign allowing you to create something new. In this case, we already have a filed agreement for Test Girl KC of support brokerage at $2,400 a year. And again, that status is approved. And the way we're able to have an approved agreement, again, is because this needs to be linked to a meeting. So it lets you kind of work in order. So again, if I were to create an agreement here, I can plug in all this information, but if I don't have a meeting that's approved for me to link it to, okay, it won't let me do it. So you need to make sure you have the approved meeting minutes in here for you to be able to create a service plan and for you to be able to create a broker agreement. Service documentation. Service documentation are your broker billing summaries that you do. In CFS, we do brokerage billing once a month. So what that means for everyone is that at this point, for example, July brokerage billing is due. So all of July brokerage invoices should have been in by August 10th. So in your service documentation screen is where you'll just keep track of all of your services each month with your individuals. So, circle of support, individuals home, you could just, it's pretty straightforward. Just go, this is, your meeting roster. You're going to capture everyone that was in the meeting, type in their names. Make sure you select the services you provided. A note on the services you're providing. Make sure that if you're saying you did that you were in a circle of support, that your meeting minutes are uploaded. Make sure if you're saying that you updated the staff action plan, that you actually updated the staff action plan. We look for all of those elements in the portal. Okay, so just ensuring that you check off the appropriate services that you stated you provided. There's a part in the bottom where you would narrate, specify the services you've provided. You're going to enter your start and stop time. Okay. And it's your service documentation is relatively easy. Just make sure that you're completing all of the appropriate areas. Okay, and that you're doing so accurately. And you would just save it. So each time you save any kind of session, any kind of service you're providing as a support broker, as you continue to save those, you can add more and more and more throughout the month. And so eventually what happens is all of the services you're capturing for the month of, let's say, July, eventually you will be able to go to Summaries, billing summaries, and you'll be able to sign off on it. Okay, so say here for the month of June, I had a series of services that I reported on my billing summary. I'll just have a complete monthly invoice that captures all of the services from within that month. And we'll go into what happens after you generate your billing summary when I get to this tab. But again, service documentation is where you enter your sessions one by one. They start to accumulate, and eventually at the end of the month, you should be able to then generate your billing summary. Any questions there before I go into staff action plans? Okay. All right, so staff action plans. Kind of like meeting minutes. These are due, we need at least, well, there should be at least 2 reviews each year for the person's self-hired community staff action plan. Again, staff action plans are required for individuals that receive self-hired community habilitation services. okay? And those are due for 2 reviews a year within that budget year. So if Test Girl Casey's budget is active from July to July, there should be 2 staff action plan reviews. And again, those typically coincide with life plan reviews, okay? Staff action plans need to coincide with the content of the life plan. So the POMs should match what the life plan POMs are. The valued outcomes should match what the life plan valued outcomes are, and the goals. The only difference with the self-hired staff action plan is that you are breaking down the goals as to what that looks like when ComHab is providing that service to the individual. So in this case, you know, we're pretending that Test Girl Casey's life plan, you know, her POM, the POM is that, you know, the goal is that she would like to learn money management. And the POM is that children and their families choose goals. For frequency, you're always gonna, you know, keep it ongoing so you don't limit to how often the staff can work on this with Casey, with the individual. And I'm gonna create a quick draft and walk you through the different sections, okay? So we're gonna pretend I'm doing a new staff action plan. I just had a life plan review for Test Girl Casey, and I'm gonna click this plus sign and create a new staff action plan, okay? There's 2 ways of doing this, and this is, I'm gonna show you if you're creating a staff action plan for the first time. So if you click that plus sign and you look at, you're gonna make sure you select staff action plan. Now, I know some people have their supported employment plans, so just make sure you're selecting the appropriate category. So we're gonna go with a staff action plan, okay? And then remember, make sure you select the correct effective date, which is typically, you know, which typically should coincide with the life plan review date, but you know, that's open to interpretation. Again, it's not gonna let you save it if you're not linking it to a meeting. So we'll pretend we just had a recent meeting. And this is what it kind of looks like. Every time you want to add services, you're going to click the plus sign. Now, note on services, we're only capturing habilitative goals. Type habilitative goal. I know that we can add supports, safeguard goals, safeguard supports. Within the services, you're only going to capture the habilitative goal, because what happens is the staff action plan translates into the services that self-hired staff are clocking in and out of. So when staff clock in and out, they are going to enter the comments on the services they provided, and they're going to select which habilitative goal they worked on. Now, what happens sometimes is that if you enter emergency services here, safeguard supports, which is technically okay, but the issue with staff is that if you're not alerting them or training them that at least one habilitative goal is required when they work with their individuals for the service to count, it can get tricky, because sometimes staff will say, well, if one service is required today, I just, you know, helped her, reminded her to turn off the stove. We just worked for an hour. You know, that's not really a habilitative service. So we're asking that you only capture habilitative goals in the services section. And in the plan additional info section, you could just copy and paste all of the relevant safeguards for the individual, okay? So going back to services, when you enter a service, you're gonna select your habilitative goal. You're gonna, you know, make sure that goal matches that of the life plan. So money management, okay? It's always kind of pre-selected to valued outcomes without life plan. You could leave it this way. Again, make sure the valued outcomes match what's on the life plan. Make sure that the POM matches what's on the life plan, okay? And frequency, I would suggest daily or ongoing, just so that we're not limiting how often staff can work on this. So I would just say ongoing, staff responsible, all staff. And you would go on to the, oftentimes there's confusion here. You know, some brokers may click OK and think this is it, but you have to click through the different tabs. So current level of performance, you would just say, you know, in this case, she still needs staff supports. Test girl still requires staff supports in the area of money management. And staff actions, this is where you break it down to what that looks like, okay? So this is a step-by-step, this is what the staff are going to see. They're going to see how they are implementing this money management goal. Then you save it, okay? And you can continue to add more and more, all right? So once you're done uploading all of your habilitative goals, you're gonna, again, in this part here, capture all of the safeguards or any other relevant information, okay? And then you're gonna save it. Once you save the plan, you still have to actually go back to click preview and sign off on it. So if you don't click preview and go back to sign off on this, we're not gonna see on our dashboard that there's a plan ready for review, okay? So I'll delete that. But so going back to the actual approved plan we have in here for Test Girl Casey, when you already have an existing staff action plan and you are just, this is just a semi-annual review, this is a quick review and updates of the staff action plan, you don't have to recreate a new plan. You can simply go into your existing current approved staff action plan and you can just review it or you can copy it. Preferably you're gonna copy it because when you click review, it doesn't necessarily let you change the effective date, which you have to every time you review it. So you're going to just copy it and you're going to say, copy to new plan, and you're gonna issue the new effective date, okay? And then you're gonna save it. And then when you save it, it's gonna basically copy and paste a new plan for you, and it's gonna let you, make the edits that you need to, so everything is gonna be populated there for you already. And all you need to do is just make the edits that came up in the semi-life plan review, let's say. And once you make those edits and your updates, rather, again, you're gonna save it and see how it makes you link it to the meeting. You're gonna make sure you link it to your meeting. So again, enter your semi-life plan review first. Go ahead and do your updates, save it, sign off on it. So preview, sign, and that should be, the end of that. So again, there's two ways. You can either enter a self-hired, a staff action plan from scratch, or you can just take your current approved plan and copy and paste it to make updates and revisions. Okay. Any questions in that area? Not a little extensive.
Hello?
Yes.
Hi. Quick question. So actually two, hopefully. One is for the POMs. I know there's a drop-down box for the POMs, but is there a list of POMs other than in the system? Because sometimes in reviewing the life plans with the care managers, it's easier to do it then and make it, kind of correct.
Yeah, so typically Evero will capture what the regulation is, right? So when Evero updates their system often all the time, they're capturing any changes that OPWDD issues. So if there's any less POMs or more POMs or whatever those current POMs are, they tend to be already there in that list for you to select from. So I think what I find most times between care management and support brokerage, it's coinciding that you are both interpreting these staff actions to fit under this valued outcome and under that POM. Or sometimes, there's a transition from children choose personal goals and they've turned 18 and now they are adults, people choose personal goals. So sometimes it's kind of that communication and fine line between how the care manager and you are interpreting what the POM is. But it's often there. It's there. The drop down.
Is that able to print that out at all or something like that? Because I find it easy to have that conversation during the life plan comment.
As to what that is, yeah. So that's a good question. Let's see.
Or even if there's another source.
I know.
We could, Jen, we could share like a list of the 21 POMs with everyone, because it's a set list. I mean, there's children's ones, but then there's the adult ones,
Right.
and it should mirror the life plan one.
Right.
We could share, we could definitely send that out.
That's good. Yeah, so Linda, if you send that to me when I send everything else, I can certainly share that, Joe. So
Thank you.
got it. Okay.
And the second question
Mhm.
is, I'm sorry, I'm gonna let go of that question. And unfortunately, right now I'm having a refrigerator delivered. Who would think it would be at the same time as this call?
Okay. All right. Well, you can email us later. All right. So that's, any other questions on the staff action plan process? Okay. Okay. So, and then the other, to kind of wrap up the staff action plan. So, once you've signed off on that staff action plan and we review and approve it, it then, you'll see on your end that it's approved. You can go ahead and distribute it. And I'll show you how when we get to the document section. But the service plan, I know a few scenarios. I know that oftentimes a life plan is not updated or provided to you within the 45-day time frame that they have. And I know that it's one of two things. We may have a broker that just knows, the content and to update their staff action plans, or some that just prefer to wait for the life plan to be updated so that you don't have to go in there twice and do these edits. What would be the best practice, or at least our recommendation here, is that you make sure you send the copy of the staff action plan to the care manager within the 45 days of the life plan meeting. And then you'll upload that distribution email in your document section, and I'll show you where. Because again, if the care manager is not responsive, or at least you updated the plan, you distributed it, and as far as you're concerned, you've met that grace period and compliance of the 45 days. And you've already, documented your attempts at communicating and trying to get that life plan. So in the event that you've not participated in a life plan meeting because they've not invited you, or us, the FI, or just, you don't have an updated life plan, we are still recommending, strongly encouraging you to update that staff action plan when it's supposed to be updated, and distribute it, and capture that in the portal. Okay. Another reminder, as an FI, and we tend to do this in the life plan reviews, this is kind of our pre-list. So, we're looking to see that, number one, that you've listed us in your meeting minutes, that we've participated in your meetings, and same thing for the care managers. We're gonna ask that you include our FI participation. I tend to distribute this right after the meeting, or sometimes before the meeting, if it's just a few items that I need to collect. And this is just our FI review. So, we double check that we have a current life plan or semi-life plan on file. We're looking to see that those goals and POMs matched what's on your staff action plan. Okay, we're looking to see that we have a current LOC, CDP2 on file. Again, that staff action plan on file. Monthly notes, if this is a person that receives self-hired ComHab, monthly notes are required. Those are due the 10th of the following month. And this is open to the self-hired staff, broker, or the family individual completing those. That is up to, the circle as to who takes on that task. But I will share with you shortly how from the broker portal that can be done. So, it's our opportunity to review that expenditures, that everything is up to date, timesheets on the portal, that services are being reported how they should be. We're reviewing that the brokers, invoices, that they're reauthorized, okay? And anything that comes up in the meeting, we'll capture some brief meeting minutes here. And again, I tend to share this typically after the meeting. Okay, but this is just so you know what we're looking for. Okay, so that's, you know, a wrap on the staff action plans. I'm gonna touch a little bit on, we touched on billing summaries. Again, just make sure that your broker invoices are in by the 10th of the following month. And when your invoices are in, there's two types of invoices. If you have a startup brokerage invoice, you're gonna make sure that you download that invoice. Once you've completed, once you've signed off on it, let's say, there should be an option for you to download it, and then you can email it to the individual or family, CC us, the FI, and when the family replies all that they've approved, we can process that invoice for you. And again, this is in the startup brokerage phase. And the reason being is because in the startup brokerage phase, these families are not yet set up with a portal account. Now, when this family receives support brokerage, or meaning they have an active budget, they are able to go into their family portals and approve your broker invoices. In that case, you're going to tell them by the 10th of each month that, that your brokerage invoices are in there and ready for review and approval. And when they approve it, I'm able to see that in our dashboard, and we can go ahead and complete that invoice request. The only time for support brokerage that I'm asking that you download a support broker invoice is when you, as the broker, are granted access to the family's portal. So I know that some families require extensive support and help in navigating their portals, and as a result, they request that we grant you, the broker, that access. If that is the case, then we're gonna ask you to download that support brokerage invoice. Again, email it to us all, CC the FI. When they reply all with approval, we will process the request. When you are forwarding support broker or startup broker invoices via email for approval, those have to be saved in the document section, because once we have, be it the email that you uploaded or if you downloaded the actual invoice and they signed the invoice, I'm gonna look in the documents to see that you uploaded that so that I can complete the request. Okay, so I know that oftentimes that's where we kind of end it, where they reply all with approval, but you should be uploading those approvals in your documents section of the portal. So that brings me to the, actually I skipped the monthly summary, but I'll go back to that. But the document section of the portal, this is where you should be uploading two very important things I could think about. You should be uploading, typically we pre-upload everything for you. So when you're in the startup phase and you've submitted all these initial documents, I tend to upload these documents in the appropriate sections for you. But anything in the support brokerage phase, you may get an updated level of care, you may get an updated DDP2. All of those things you should be able to upload onto these folders. But what's more important is when you do a staff action plan, and if you go to self-directed services, there's a distribution documents folder. This is where you should be adding, a copy of, let's say, your email. Let's say you want to just upload your email distribution today, distribution of SAP 812, and you would save it. So it's very important that when you distribute your staff action plans that you upload in the distribution documents under SDS, your verification of distribution. Okay. As far as the broker invoices, typically people will, brokers upload it in, again, under self-directed services, SDS broker summary. This is typically where, you can upload your approval. All right, so if you just type in, July SUB or brokerage invoice 2020, I'll know that you uploaded it there, and I'll proceed to go back to my dashboard screen and approve your invoices again, for startup or for support brokerage if you have access to the families portal. Okay. Monthly summaries. The first part is, do you do monthly summaries even if the individual is not receiving ComHab at this time? So long as the individual has approved self-hired ComHab services or SEMP, there should be a monthly summary. And if there is no staffing, then you'll just indicate there's no staffing and what the efforts are to obtain staff, to find staff. So in creating a monthly summary, you're gonna, make sure you select the appropriate program. Anytime you wanna create something new, you're gonna click that plus sign, select the appropriate month. So say July, this should kind of preload for you. So self-hired ComHab, self-directed supports. Plan date it's gonna ask you for your staff action plan date. You're gonna click OK. It should bring you to the screen with the preloaded services here. So in case you would like to learn money management, monthly progress, improved, maintained, whatever the appropriate progress is, you're going to, it's relatively simple. You're just gonna make sure you click all of the appropriate boxes, and then you're gonna have the opportunity to provide a description here of the services for the month of July, what that looked like, any hardships, any concerns, any good shares, or you'll simply say presently no staffing, or given pandemic, or interviewing staff, whatever that is, you're gonna capture that here. And once you save it, you still have to go back and sign off on it. So if you don't, you can click save, but if you don't click preview and sign off on it, it's not gonna like this. It's gonna just stay on draft mode. Okay, so just make sure that you sign off on those. After you click save, you click preview and then sign or review, and that should register the monthly notes for you. And again, this is if you're the designated person doing the monthly reviews each month. They're due the 10th of the following month. So you could probably do those with your monthly invoices. Okay, so we've reviewed that. Any questions before we move on?
Jennifer, the monthly summary is the broker have to do it or the parent?
That's up to the circle. It's, it is typically, I see it in this order: broker, family, staff. So the self-hired staff are able to do this from their portals, which would be, I would think, the easiest thing, because they are providing the service. But this can be the broker, the self-hired staff, or the family. It's up to the circle. Okay. Let's see. So and I'm transitioning into outside of the portal into some of our processes. So for startups, transfers, there's a series of things where we request and review before we submit your request to the DDRO. Okay, so when let me see if I can, how do I stretch this out? So when you are looking to broker for someone, become their startup broker, we're going to ask you for these list of documents here. Okay, so the NOD, the broker agreement, the startup broker budget, level of care, DDP2, life plan. Just these list of documents here. Now, depending on the borough, there may be some additional things or less things. So for example, if you are requesting startup brokerage services for an individual in Manhattan, in addition to all of these documents, they're going to also ask that the life plan list CFS self-directed supports, or just whoever the FI is, as a pending provider. So some DDROs, this is just a general list, but we may turn around and ask you for a few additional pieces of information because of what that specific DDRO region requires. Another thing that's not in here is some regions may ask for what they call the broker checklist, not the broker, but the 6 checklists. So Long Island requests that. Service authorizations, Long Island requests that. And most of them are often asking now for the self-direction certificates, meaning that the parent or the individual or family attended that front door or SD session. So this is just a general list that includes, but it's not limited to these documents when you're requesting startup brokerage for these families.
Hi, Jennifer, it's Cynthia. I have a question. Last medical, a copy of the last medical, is that something that you need for a startup?
We don't need it. This is for us. So some of this is internally for us to learn the individual, their profile. Same thing for psychological, psychosocial. Sometimes you guys may see that I ask for all these documents, but DDRO is getting NOD, they're getting the broker, they're getting the essential documents. But some of these documents are for our purposes, especially in startup or a transfer, a completely new individual to us. We want this history on them.
So if they don't have a medical that they have done, there's no evidence of a physical medical document, would you process the startup without that or not?
Case by case basis. Typically someone, may reach out and say, these are the efforts in obtaining a updated medical, psychological, or given the pandemic, this is closed. In that case, yes, that wouldn't stop us from submitting it to the DDRO. We can ask for it at a later time.
Okay, thanks.
Okay. So same process, well, I shouldn't say same process for transfers. For transfers, we're gonna ask for the similar documents with an additional step, okay? So I'll get there. But what's more important, and this is what I wanna emphasize to everyone, as the broker, when you're requesting any kind of startup or transferring an individual to RFI, you would be the one responsible for submitting the requested documents in one single email. Now, sometimes if I have to turn around and say, there was a mistake here, or the Medicaid didn't match the agreement, or the agreement didn't match the budget amounts, you'll just have to resubmit what I asked you for revisions. So it's not that, you have to resubmit everything, just resubmit what you had to revise. If for some reason I need you to resubmit everything, I will indicate that, okay? When transferring, when an individual wants to transfer to RFI, same thing, you're gonna submit everything in one single email. We're gonna ask for the similar kinds of files, records. The difference is you're going to also forward us their self-hired staff information. So if this is a person that currently has self-hired staff that are actively working with him or her, they need to be cleared with us first before we submit this request to the DDRO, because then they're going to risk a lapse in coverage. So if we're looking for someone, if someone wants to transition to CFS effective September 1st, but we didn't get the self-hired, request for September 1st onward, they might just have to wait till October till they complete that process to start working with the individual. So you want to make it a seamless transition where the people are getting cleared and getting transitioned to us. Meanwhile, you're also transitioning their services to CFS. Okay. Status of startups, there's an increase. I thank you for the, rapid growth we've had and you know, your increase of startup referrals. As you keep those coming, just, you know, keep in mind that we would like to make an attempt to submit initial budgets and all necessary documentation in a timely fashion. And what I mean by that is every case is different, everyone has different needs, and it's not always so simple. But you know, if within 2-3 months you can get that in on average is what it kind of takes for a person-centered process, that would be ideal. I would love to square away as much as possible any initial budgets you have coming in before my leave in September, especially because, you know, not only are you submitting the initial budgets, but there needs to be time for review, revisions if any, and then launches, right? Because especially initial budgets can be more involved when it comes to launches and new families and individuals coming to this big world of self-direction and everything that's all of the moving parts that are in it. So, you know, just a note on that. Also a quick note on FI sustainability. You know, we encourage you guys to maximize your brokerage billing, be it in a support broker or startup phase, as much as possible. Because what tends to happen is when budgets transfer over or we have initial budgets, it's tricky because the idea is that you know, you and the family develop this budget of what ideally the services would be and what the individual's needs are and wants. And sometimes it doesn't necessarily always play out that way. So oftentimes you may have an individual say, you know, I want self-hired ComHab, but perfect example, we're in a pandemic and it's not always a safe scenario to have face-to-face, but the individual struggles with telehealth, let's say. In that case, there still should be other areas of the budget that as a broker you can support the family and utilizing, you know, be it your supports, be it telehealth, be it, you know, community classes, virtual classes, again, to sustain this budget and that we can, you know, maintain and pay out this budget. So, you know, ideally, if you want to think of an average of finding a way to help the families utilize the budgets at least twice a month, or involve us where needed. If there's difficulty with staffing, sometimes we can issue blast alerts, availability for XYZ. Individual is looking for staff here, 5 hours a week, and we can help facilitate those kinds of things. So just reach out to us. Just a few notes. Direct deposit, we're strongly recommending this if you want to relate this information to the families, for yourselves and for self-hired staff. You know, there's an ongoing issue with, you know, I guess, you know, pandemic related that, you know, we'll see that people will reach out that they're not getting their paper checks. And sometimes, so oftentimes we'll stop the payment, and by the time we stop the payment and issue the new check, you get the copy of the stopped check and you're depositing the wrong check. It becomes a little sticky and messy. So, you know, we strongly encourage direct deposit. If you're interested in that, all I have to do, you could email me. I would send you the ACH form, which you just electronically complete. When you do that, I'll ask you for a copy of the signed void check or bank letter, and that will process your request. You would just have to email me. I'll wrap up with, I wanted to quickly show you our webpage, which is CFSNY, okay? And in our CFS page, if you go to services, CFS self-directed support is our FI page, which is often updated and includes a lot of, you know, extensive information. This is especially if you're meeting, you know, a new family, or they want to learn about our services, or even you if you're a newer broker to us. Just, you know, it just has a lot of information, but the top part usually consists of our launch processes, our checklists, even our employee handbooks, because I know oftentimes when families are looking for employees, they may have specific questions related to paid time off, just our policies, procedures, healthcare, things like that. You know, we tend to try to keep updated with the OPWDB links, our IDS charts, and just all of the all of the regulations we go by, issued by OPWDB. Evero often has training resources or just general updates. We try to capture that here. Some of you have seen we typically pre-record some of these things when we're launching a new family. They'll have a pre-recorded parent portal training. They'll have a pre-recorded staff training on how they utilize the portal. So we encourage you to encourage them to review these before they ask any questions. And then oftentimes when we try to keep the momentum of biweekly meetings. And for anyone that misses the meetings and wants to check them out, we upload them later on the web. Okay. And lastly, I encourage everyone to check out our, if you go to news events, you could share this link with your families, individuals. There's a series of different just workshops and expression classes, DBT groups, movie nights, and Linda is huge on bingo. So, and she says there's prizes. So I encourage everyone to check out our events page, and these are virtual at no cost. So we encourage you guys to take advantage of these. Last thought is so we have Faye Simon has been with CFS, is still with CFS, and is just rejoining us at a full-time level again. So during, I am programmed to be on leave from end of September till mid-December. During my leave, Linda has always been our contact person, Director of Community Services here at CFS, and Faye Simon is rejoining us full-time. So any questions during my leave, comments, concerns? I've been, as you have all probably started to see Faye on a lot of our day-to-day business, and Linda has always been involved. So as things come up, you'll continue to see me increasingly CC them so that they are abreast of your individual families, cases, and just situations, so that the leave can be seamless and we have an open line of communication. Questions?
Jen, Barbara wanted to know, do you want the budgets on the budget template or in eVero?
I'm fine with however you, I'm flexible with this, I would say, because if you do and I've seen a few cases where sometimes especially in startup, you tend to do the startup broker template outside of eVero. And that's what it's gonna be because we've not set you up. So say, Barbara, you have a new individual for startup and you submitted all of the documents and the budget template. You're gonna do that outside of eVero because this is a new referral. We've not entered them on the system. We tend to enter the person on the system once we've received an approved startup broker authorization, or once we receive an approved transfer. So yeah, so you're gonna do your broker, your budgets outside of eVero the first time. After that, I encourage you to do your budget amendments, your initial budgets, everything else from the portal. It would make the most sense because eVero is gonna always capture your most updated templates, your most updated data, and it's just gonna transfer everything over. So if, like, let's say for Test Girl Casey, I did a startup broker template outside of eVero, it was approved, my FI imported it, and then I created the initial budget from the portal, it's gonna translate all the prior information from Test Girl Casey to my initial budget. Now all I need to do is plug in the new services. So first time outside of eVero, anytime after that should really be in eVero. But if you choose to do it outside of eVero, I think that would be double work. But if that's what you choose, I'm okay. It's okay because we as an FI are still going to review that the budget is consistent and it reflects all the current information and matches all your other documents anyway.
And eVira also has nice tools to prevent you from exceeding PRA or budget category lines. So, you know, it's helpful to take advantage of those tools that they set up.
Right. Mm-hmm. Same thing with CNBA. When you do a CNBA on Ivero, it'll let you, type out all your changes there. It'll do all the math for you. Sometimes you have to download a CNBA form and click here, click there, and then go and create the budget to match the CNBA. Whereas if you just do it on the portal, it's just going to do it for you. So I would think I know the first time around you have to create it, but the second time once you have an approved budget in there, you should really be doing it from the portal. I'm sorry, someone had a question?
Yeah, Joe Compagna here. I'd like to report that my new refrigerator is in, so thank you for your patience. And if we need to go offline because you've already covered this, that's fine. On the staff action plans, so did I miss part of it where, so we did the ComHab, self-hired ComHab, but is it necessary to do the other tab for safeguards, or like what you're saying, you were putting those safeguards with the ComHab? I missed that.
Yeah, that's fine. So when you're creating a new staff action plan, okay, right, this is what it looks like. You're going to list your habilitative goals one by one under that services section.
Right.
So you're going to click that plus sign, habilitative goal 1, plus sign, habilitative goal 2, okay? Your safeguards you're going to copy paste here.
So something like call for help or evacuate, stuff like that, that goes in there.
Yep. Mm-hmm.
Okay. Second quick question is, I noticed on test girl Casey that she lives in Orange County. Do you guys service up in Hudson Valley? I thought.
No.
Not yet, but soon.
Still in process. Okay.
I didn't even know she lived there, but thanks, Joe.
That's fine. And you'll be posting this recording so I can catch my parts that I missed, right?
Yes, yes. Mm-hmm.
Okay, thank you.
Okay. Oh, here's the question. Did I miss any questions from you?
I think you covered the questions in the chat.
Okay. Okay. So if any other questions, you guys know to email me. I will get right back to you. I would say following this meeting, I'll share that updated broker policy. We'll forward this recorded training, and we'll go ahead and forward you that list of the POMs, so
Great.
you can have that handy.
Hey, Jen, did you want to just take a second to go back to the website and just show those forms again, just in case anybody had questions about those?
Thank you. Yes, thank you. So, right, one of the other things, I'm sorry, yes, completely forgot. So one of the newer things we've also put together is this goods and services justification forms. So what's starting to happen is that, oftentimes we'll have someone that wants to transfer to RFI, or in the midst of the, PCP initial budget process, there's often the questions, can this be reimbursed? Can this be reimbursed? And we'll look at real quickly at a web link that you or the family provided. It looks like it is. So we'll say yes, but then the invoice reflects something totally different. So just to keep it clean and easy, and instead of having to develop all these extra other forms, we try to just keep everything electronic. So we are requesting that these forms be completed. Okay, I've shared the link before, but if you just go to services, CFS self-directed support, and you click that link of goods and services justification forms, it's relatively easy. We developed, I think it's 3 forms. One is for household goods. Okay. And, just make sure you fill out each part. And it's relatively easy. It's just going to ask you to indicate what valued outcome that is from the life plan, how it increases the person's health and safety. And once you sign off on it, right on here, it's just, we're gonna get a completed copy. So there's nothing for you to download. There's nothing for you to print. It's gonna just register on here. We'll get a completed copy. We'll review it and you know, hopefully approve it. And that'll be that. And you're doing this just one time for any, you know, new service. So it's, you know, if a person is gonna go to JCC for swimming, you're only gonna have to do that once. So we also have the OTPS justification form. Okay. And this is typically for those gray areas of the health and safety or the increase in dependence category. You would use this form. And then the last one, more popular one, is this IDGS community classes one. Okay. So those are the three forms. You know, memberships are memberships. We don't really need to, you know, verify that a membership, I think, is a membership. As you can, you know, everything outside of these three forms, you can continue to just send us or the family the link, and if they want a direct vendor pay that W-9. But within these areas, the form, we will require you to complete the form, or the family. I think it's easier, you know, for the broker to do it because you know what you're looking for. And this brings us back to the importance of these life plans. You know, we have to make sure that these life plans, that the narrative is capturing all this information extensively, that they're reflecting what they're supposed to reflect when it comes to self-direction. You know, oftentimes these life plans will say that ABCD services are approved on the budget, but they won't specify that the person does a lot of traveling to New Jersey or neighboring states. And that could, you know, be a big problem. So, you know, just make sure that the life plans include all of the elements that reflect what's actually on the person's budget and what they're using. Okay, so yeah, thank you for that, Linda. Yeah, so these forms, we are requesting them moving forward. And what happens is when they are approved, I do go back and save those for you guys. So once we approve it on our end, I go into the individual's profile and I save it under self-directed services, well, it'll say something like IDGS or OTPS. So I'll make sure I plug in the approval in the correct folders for you, so you don't have to like save them or keep track. They're in there for you.
Now, Jennifer and Cynthia, I just have one question. So do we get an email once this is approved, just so that we can go ahead and alert the family that this is approved?
Yeah. So when we got the alert that you signed off on this, we review it, and just like you signed off, we're able to click sign, and you're gonna get that alert that it was approved.
Okay.
Yeah.
And I think just to reiterate this, we're not trying to, we definitely don't like more paperwork, but this is, we thought, an easy way to make sure that, you know, since there's such gray area, especially with these three categories, that as long as you've looked at those specific points that are pointed out in the regulation, we've documented and we have it in our file, I think we feel comfortable with that, instead of like Jennifer said, making decisions like, you know, through email and this kind of thing. I think as long as it meets all the criteria that's established, we're good to go.
Mm-hmm.
Hi, Joe Capagna again. Quick question on the uploading of documents. Is that a billable action? Assuming you save your monthly ones and then you do them all at one time or something like that. And obviously, you can't. You have to separate it by client, but.
I wouldn't think so. I don't know how, you know, when the nice thing about Ibero, right, is when you do service documentation, I guess think outside the box, right? When you have to go onto Ibero and report and enter your service documentation, and then there's that checklist for you, right? Mm-hmm. I guess you would select which one makes the most sense, and then in your description, justify what that looks like. But I don't think that there's anything in Ibero that says, you know, I had to upload 10 files, and then on your description, it took me an hour to upload 10 files. I think maybe it would be, there's a checklist that says I reviewed the staff action plan, life plan, and ensured it's being implemented as it should. And then in your description, you would say, I uploaded all these files before I reviewed them. Right. 1 hour of service.
So it's kind of an add-on to the other action.
Right.
Yeah.
Okay. Gotcha. Thank you.
Jen, I just wanted to reiterate, again, what you said before about we're just so thankful that you guys are choosing to support CFS, and if there's anything that we can do to help, make your life easier and the family's life easier, just continue to communicate so that we can be regularly looking at our processes and ways that we can support as well. But again, just a word of appreciation to all that you're doing to help the families and individuals actively engage in self-direction.
What percentage
you.
of brokers that you have are on this call, just out of curiosity? Or
You know what?